Take this. So it seems like I get a lot of horseback riders. And the horseback riders ask the question that you asked, which is, and usually I take it as a little bit condescending, because usually they'll go like this. Dr. Rutledge, do you ride horses? No. Well, you may not understand this question then, but how soon can we ride horses after surgery? I said, oh, right away. Right away. You can ride horses right away. Well, you probably don't realize how strenuous it is to ride horses. I said, no, not really. I go on the carousel, but... So see, I get these guys, they're really upset that it's really hard, I guess, to ride a horse. So, very strenuous. And so I'll say, well, you can ride a horse right away. And you can go to the gym right away, things like that right away. They go, well, it's really hard to ride a horse. I go, oh, well, right away. Now, what this is based on is a lot of people have heard something like this. No heavy lifting for 6 weeks after major surgery. Have you heard that? Kind of something like that, some version of that. And the idea there is kind of common sense. If I kind of split you open and sewed you together with fishing line, which is kind of what open surgery is like, the body comes in and over 6 weeks takes little cells, glues in some collagen, and then forms a scar, and that takes time. And we know that if you pull on that prior to 6 weeks, you can get a hernia. It can tear it apart. So most people have heard of and think about no heavy lifting for 6 weeks after our surgery. Now, if you've seen some of the videos or seen the surgery, we do make a small cut in the skin, but then we go through the abdominal wall with actually a plastic tube that looks a lot like a Bic pen. It has a pointed tip, but we push that through the skin and what's called the fascia, and the fascia is a little bit like kind of Venetian blinds. So when we go through the fascia, it goes between the fibers. We do our surgery, and when we pull it out, the fibers slam shut. So it means that hernias after our surgery are extremely rare, and it also means that you could lift weights right away. So you can go to the gym essentially the day of surgery if you wanted to. Now, most people have some aches and pains. You probably didn't feel like it the first night to go to the gym or something like that?
No.
No. So, but she could have. There's nothing as far as that wound, like the open wound, that would have prevented her from going directly to the gym. And so you can go back to training at any time. And you can ride a horse too. So that's a good question. So you can go back immediately.